We must wage what I have called total war against public enemy number one.
It's hard to tell a story more from keeping someone from being
We must wage what I have called total war.
It's hard to tell a story more compelling than keeping someone from being dead.
Is an abomination.
It's hard to tell a story more compelling than keeping someone from being dead.
It keeps people safer.
Toronto has the province's largest number of people who use drugs. While there is division in drug-related policy and practice, it is clear that the status quo must change. For decades, the language of war and condemnation have impeded our ability to humanely and practically work with drug users and drug-related harm. While the harm reduction strategies that are already being used in the city are making strides in reducing the potential harm to drug users, it is clear that there is a definite need for additional services. After speaking with harm reduction workers, users, and reviewing the TOSCA study, it is clear that a comprehensive harm reduction program in a city of Toronto's size should include a safer consumption service.
Abstinence is also, a part of harm reduction, and if abstaining was the thing that's going to be the best fit for this person, then that's, that can be a goal of theirs. It's not that we require people to keep using as, to participate in harm reduction. But that it's about making a non-judgmental space so that people are able to access other resources, whether that's detox or whether that's AA or whether it's to continue using. But that they are without feeling coerced, or that they have to perform a certain narrative to access services or to get other things that are essential health services.
It's a matter of breaking that programming of reaching out through activism, through dialogue with people. Because once people truly understand what harm reduction is, that it's not just facilitating drug use, that there is no value judgment involved about drugs. They're not good, they're not evil. They just are, and people are using them. And people are dying the way they're using them. So why can't we change that?
TOSCA, the Toronto and Ottawa Supervised Consumption Assessment Study. It's a needs assessment and scientific study to determine the need and feasibility for establishing a supervised consumption facility in Toronto and Ottawa. While the study speaks about both Toronto and Ottawa, we will only be focusing on Toronto.
For me, it's more interesting and more useful to kind of look at people coming to a supervised consumption service as people taking steps towards managing their health, as opposed to people looking to, use drugs and engage in criminal behavior. It's hard to tell a story more compelling than keeping someone from being dead.
About 1 in 5 people who use drugs in Toronto and in Ottawa reported that they have overdosed in the last 6 months. The majority of these deaths were the result of injection drug use. As we heard over and over again, these deaths are preventable. A harm reduction worker shed some insight on some of the reasons overdose deaths happen.
People, they don't know always what they're taking. Drugs change, the potency of them changes often, and people go to jail and they come out, or people go to treatment and come out, and that's when people are most at risk of dying. And at my workplace, we're building a drug user memorial for all the people that have died, and it's constant. It feels like a battleground for drug users. And there was one month where we had lost, I don't know if it was 16 people. It was just huge, and we've lost a substantial number of folks in the community where I work that were just pillars to the community, where people loved them so much, and they didn't live past the age of 50, that their lives were lost to overdose death.
In 2009, there were 74 known opioid overdose deaths in Toronto. 71% of people who inject drugs in Toronto said that they would use a supervised injection facility to both prevent overdoses and get overdose treatment. Among youth who inject drugs, preventing or treating overdoses was the most common reason they would use a supervised injection site.
this is just one more way in which to prevent overdose deaths and save lives. Places where people can go where, if they were overdosing, that there would be people there to help them come out of an overdose, that there are folks there to care about them.
Overdose deaths seem to be a fairly widely shared concern among Torontonians. More than half of the Toronto residents surveyed agree that supervised injection facilities should be made available to injection drug users if they can be shown to reduce overdose death or infection transmission among users.
There's a lot of medical and social kind of problems that come about from public drug use.
HIV and hepatitis C are transmitted when the blood of a person who is infected gets into the bloodstream of someone who isn't. HIV predominantly affects the immune system, and hepatitis C predominantly affects the liver. A social service worker with lived experience gave us an example of how infection transmission might occur.
Down under the bridges and stuff like that, really, dirty environment, right? You're underneath the bridge, carbon monoxide and 1 yards, but you don't have a fucking rig, and you're having junk pain, and you are desperate, you are fucked. You know what I mean? How many people I've known don't even think, or the guy next to him doesn't think to even fucking tell you, or gives a fuck about himself or herself to tell you, I'm infected. And, oh, you need a rig? Oh, can I get a little bit off you? Can I get a little bit off you so you can use my needle? Yeah.
It is estimated that 1 in every 120 people in Toronto are HIV positive. It is also estimated that 110,000 Ontarians are living with hepatitis C, the majority of whom are current or former injection drug users. The TOSCA study tells us that safer consumption services in Toronto would mean that 2 to 3 HIV infections and 15 to 20 hepatitis C virus infections would be averted per facility per year.
And supervised consumption services also are not only a great way to save lives, but also to help limit the transmission of HIV, hepatitis C, and so forth. And we know through the study that they showed that there would be a decrease in hep C transmission, something that I haven't seen in all my work as a hepatitis C worker. Anyone who can prove that there would be a decrease amongst injection drug users. And in this study, they show a significant decrease.
Beyond the health-related benefits of reducing transmission of these infections, there is also a financial benefit.
So there's a lot of evidence that talks about how supervised consumption services or sites actually don't increase kind of like social harms to the neighborhoods that they exist in.
Right.
And I feel like that is one of the biggest things. Is like, oh well, like even if people can get over the idea of it existing, they just don't want it anywhere near them.
Nice townhouses and stuff like that. And those people have gates up and are looking across the street at something that they want out. Yeah. Property value downtown is going up and forcing people into situations, forcing TCHC to reallocate and allocate people.
Not in my backyard is an attitude that on the surface reflects a concern by citizens for safe neighborhoods and for the maintenance or increase of property value. This attitude is a crucial component in how the public is sold on the ongoing gentrification of Toronto neighborhoods, that new development will, quote, revitalize neighborhoods. But if we look closer, this attitude also reflects the dehumanizing myths hidden in stories of dangerous drugs and the people who use them. The war on drugs and the social demonizing of people who use drugs has depicted members of our community as enemies and has encouraged the belief that this enemy can be eradicated. Instead, the original members of these neighborhoods are no longer able to afford to live in their communities, and they are pushed out of their homes. A harm reduction worker begins to address the issues around community.
Members of our communities use drugs. Some of them do it, like some of the drugs we use are socially acceptable and even applauded, and some of them are punished. Yet everyone, is a member of our community still. And that's the thing that is really frustrating for me, because it's difficult to compel people to care about others that are easy to be made invisible.
What that's doing is it's pushing people as they come, right, out of the downtown core, off of the streets, out of those cultures which are being, they're being barraged with you're not welcome down here in the first place, but yet so out of sight, out of mind.
What is clear from the interviews in the TOSCA report is that current policies and laws challenge the safety and sustainability of communities of people who use drugs, which pushes them into more dangerous sites for injection and deeper states of isolation.
Just a safe place for people to be injecting drugs that doesn't exist here, and so people, have to inject in places like bathrooms of libraries or in coffee shops or restaurants or, wherever there's a public washroom that people can get access to.
When I used, there was no harm reduction. I used sitting backwards on the toilet, fixing my head up on the back of a toilet in some bar or library, or in an alley or in a stairwell. And people die in those places, alone.
And if they're injecting alone and there's nobody around, then there's nobody to save them.
While isolated drug use happens in many different places, those that live on the streets have few alternatives but to use in potentially unsafe and isolated spaces. We spoke with a peer outreach worker who shed light on the issue.
I ended up on the street, and then God works in mysterious ways, and I got to learn the real problems people were facing on the street. They turned to using crack and opiates and other things, just to make life on the street easier even.
The real problems of people on the streets are problems of survival, of systemic devaluing of their roles within the greater community.
Well, we can't blame the people for wanting to use them, considering the majority of these things come from rape and trauma and boo-hoo, right? Boo-hoo. Now there's people, man. They're children at one point. They're going to have children that are going to have these problems.
When people are in more pain, they take more pain medication.
With this said, not all people who use drugs are victims, and many individuals use for a variety of reasons beyond pain management. Regardless of their reason for use, a human response to the risks of public drug use lies in the offering of safer consumption services where people can be connected to one another and to important services.
I think that they also work as great places of engagement where we can actually engage with drug users, and, if people need help, or that we could help folks, and if people need referrals to services, that would exist. Or
it helps to draw people in that haven't traditionally or don't otherwise have access to the center, and to other health services. We disallow people, we don't offer strategies for coping, and then we disallow people and criminalize strategies that people use for finding ways to fucking get on with their lives and deal with their day-to-day, and then we fucking put people in jail for that.
While increasingly some policymakers and researchers are moving on from drug war policy, the recent Omnibus Bill C-10 features mandatory minimum sentences for drug possession. This means that sentencing is no longer in the hands of the judges, but predetermined by our current conservative federal government, which allows little to no room for people's stories and circumstance. In 2011, there were 7,450 people charged under the Controlled Drugs and Substances Act in Toronto.
drug policy is drugs are illegal. So until drugs are decriminalized, then no, I wouldn't say that it's necessarily a safe city for drug users.
You know, I mean, I see police officers arresting addicted to drug addict squeegee guys. One squeegee guy, 8 cops.
A great deal of the overall police resources go toward drug-related enforcement, creating an antagonistic relationship between law enforcement officials and people who use drugs. The fear of police interactions and law enforcement is made that much clearer by TOSCA, which states that the most commonly reported reason that people said they would use a safer consumption facility was to avoid being seen by the police.
Drugs are evil. People who use drugs are evil. You know. So therefore, we can do whatever we want to them. It's become a justification for harsh treatment of people who don't really deserve it.
Despite all of the efforts to police and demonize drug use over the last 4 decades, the war on drugs has failed to reduce drug use in North American society.
The drug war has failed, and it is failing, and we're locking up, some really amazing people in jails and holding them in cages for something they put in their bodies. People say that they would use one, that there is a need. From the TOSCA study, it shows that there is a need, and people say that they would actually use a supervised consumption service or injection service, that, people highlight a need and that they would go.
While the evidence points to a need for these services, the next step is addressing how and where these should be implemented. When asked about the ideal setup, workers, users, and the TOSCA report recommended that they be joined to existing harm reduction services, which will allow for more productive conversations around change in policy and societal perceptions.
So if we can have spaces where we can have these kinds of conversations and address the concerns of constituents in our communities that are not using drugs and that feel fearful of drug users or people using drugs, then we're able to kind of unpack some of those stigmatizing concerns and questions.
You can judge a society by how it treats its most marginalized community members. We have both research and people with lived experience telling us clearly that safer consumption services would reduce overdose deaths, transmission rates of infections, healthcare spending, isolation, increase engagement, and reduce negative interactions with the police. Safe consumption services of this kind have been successfully saving lives and reducing drug-related harms around the world. Other Canadian cities have created or are close to creating services that will be able to serve the same crucial role that Insight in Vancouver has since 2003. It's time to add safer consumption services to the already existing harm reduction services in Toronto.
If we had these services, there are people that I know and care about that would still be alive, and they'd be able to continue contributing to my life in ways that were meaningful for me and to their communities in ways that were meaningful to them.
To me, it saves lives. It keeps people safer, and where there's life, there's hope.